Hey there, Dr. Rory Cernick again from the Hearing Assessment Center, and today, rather than talk about ears, let's talk about eyes first, and in particular the pupil, and what our pupil within our eyes has to do with our ability to hear in background noise. So today, let's introduce a term, pupillometry, and pupillometry is a scientific measurement of pupil dilation as a function of cognitive processing. So the more cognitively demanding a task is, or the harder our brain works, the larger one's pupil size will be. Let's try an example. Next time you're in the bathroom, face the mirror and focus on your eyes. Create a math problem out loud, and for example, I'll say 14 times 26, and as you're solving the problem and determining the answer of 364, observe your pupillary dilation, and after 3 or 4 attempts, almost everybody should be able to see some type of pupillary dilation which accompanies cognitive effort. So how does this relate to how our brain hears? We know that hearing loss is the most modifiable risk factor of dementia, and we know that research suggests a potential pathway between hearing and cognitive decline, and we believe that listening effort and a term called cognitive load are the principal mediators. So right now, researchers are investigating whether increased listening effort measured through pupillometry is associated with cognitive decline, and we suspect those who exhibit a higher listening level in noisy environments will have an increased chance of cognitive decline. So it's fair to say the more you struggle hearing in background noise, the more likely you are to develop cognitive decline, particularly in the areas of working memory. So to say this straightforward, the more you struggle hearing in background noise, the more likely you are to develop dementia. Knowing this, it is crucial during your routine hearing assessment and test that we measure your listening effort in background noise, and we do that through a test called the QuickSyn. It's a signal-to-noise ratio test, and many of you watching this have undergone that procedure, and all you do is that your brain is required to pull a sentence out of varying levels of background noise. So when we're young, a teenager can go into a restaurant, for example, and it doesn't matter how loud the background noise is, their brain can separate speech modulation from that background noise. Now, not in the too distant future, we will probably in the office in real time also be performing pupillometry during that task. So please, if you have it, utilize your hearing technology. It will reduce your listening efforts and reduce your risk of cognitive decline. Who would have thought that treating your hearing loss may preserve your cognitive function? Thank you. Until next time, Dr. Cernick. See you later.